Welcome to HealthDesk channel. I am Dr. Srilekha from Happy Smiles Dental Clinic. I am an oral medicine and radiologist, in short, a dentist. The teeth should be taken with utmost care because they are the gateway to our whole health. Today we will discuss about dental problems in children. The most common issue or the concerns of parents are highly or multiple number of caries in their teeth and blackness present in every particular milk tooth of their children, and as well as severe pain in kids. So this creates lot of problem and worry and makes the parents anxious. There are three problems that occur very vigorously in children. One is rampant caries, second nursing bottle caries, and third is multiple caries and abscesses. So first let us see what is nursing bottle caries. When you see brown color spots on all of the front upper teeth in children, that indicates that it is a nursing bottle caries. What is this nursing bottle caries? When children are fed with bottles of milk in the night time, they tend to retain certain amount of milk in their mouth. This causes their upper teeth to discolor and eventually leading to cavities. This can also occur because of breastfeeding by the mothers in the night time, wherein the sugary milks are retained in their mouth and the upper teeth are mostly affected by this particular habit. So this nursing bottle caries should be prevented by not giving additional sweeteners in their milk, and also avoiding nocturnal feeding, that is feeding in the night time. Or make the child rinse his mouth as soon as the feeding is done. This will help in preventing this nursing bottle caries, which might eventually lead to bigger problems. So initially these can be prevented by such habits, but the treatment part, when it comes, the dentist will apply either fillings to help resolve this problem, or also fluoride varnishes to help prevent further spread of this particular caries. The second issue that children face are the rampant caries. Unlike the nursing bottle caries, where only the upper front teeth are involved, rampant caries presents as black color spots and part of the teeth on either side is eaten away, and more number of teeth, that is more than 5 to 6 teeth, are involved. So every tooth is decayed in this particular children and they appear as small spikes instead of teeth. This is a very high raising concern, and also it worries the parent a lot. This rampant caries occurs because of high amounts of bacteria present in their saliva, and this bacteria invades every particular tooth structure in that kid, and it will result in high spread of the caries to all of the teeth present. This rampant caries should be detected early. If it is seen in 1 or 2 teeth, they have to consult a dentist and get fluoride varnish, which is like a fluoride paint which is painted all over the teeth to prevent caries, or at least get that tooth filled up, so that this will help the patient to prevent the spread of this caries. Rampant caries spreads very fast, so the parent who is taking care of the toddler's teeth should be very much observant and spot that initial one caries which they find, and attend or visit a dentist nearby. The third issue that children face are decayed multiple teeth and abscesses. Normally, why a particular tooth or a milk tooth leads to abscess in a kid is because of non-expressiveness of this difficulty in kids. Usually kids do not express that they have pain while chewing. They tend to shift the position of chewing to the other side. So what we can do is, when we are observant, we can observe that the child tends to put a finger in the mouth and tries to take out the food, or either tends to eat only on one side comfortably and avoids the other side totally. This indicates that they have developed cavities. So every year one visit for every child about 3 years old is a mandatory to prevent all such type of caries lesions in children. What can we do to prevent any of the rising cavities? Every year once a dental checkup is done, a filling can be placed, and secondary preventive treatments like pit and fissure sealants and fluoride varnishes can be applied, which helps the child to get rid of these cavities as well as prevent the spread of these particular problems, and help the child have a beautiful and happy growing age. Thank you.